What are the main types of hair loss people should know about?
The most common and frequent type of hair loss is something called androgenetic alopecia. The second one that people should be aware of is something called telogen effluvium, which is stress-related hair loss. Alopecias are hair loss types that are not reversible. So where alopecia areata is also autoimmune related, it usually is reversible. Whereas scarring alopecia is usually not reversible.
Number one, don't diagnose yourself.
Yeah, don't diagnose yourself because, I mean, even
Don't do
professionals
that.
can misdiagnose.
Welcome back to Let's Talk About It with Kelly. This is my husband, John. He's our trichologist at Freedom Clinic, Toronto. Today's topic is types of hair loss. So I'm going to ask you some questions, John. Hopefully you can answer them
Yeah.
for us. First question, what are the main types of hair loss people should know about?
Okay, so let's talk about, there's specific types and then there's a couple of categories that we want to be aware of. So the most common and frequent type of hair loss is something called androgenetic alopecia or pattern hair loss. This is the most common type of hair loss that people experience. It is the type of hair loss that appears as a very clear pattern in men where you get thinning on the top of the scalp.
Right.
Sometimes it leads to baldness on the top and you have leftover hair on the sides and back. Okay. This is a pattern and that's what's known as pattern hair loss. In women, it looks a little bit different. They generally don't go so bald or recede as severely. They'll generally just thin out in the top area. So that's what androgenetic hair loss. Now it should be important to note that these conditions can spread beyond the patterns, the typical patterns, but most of the time they appear as these patterns where it's the top area that thins the most. So that's the first most common
That's
type.
the most common.
Yeah. The second one that people should be aware of is something called telogen effluvium, which is stress-related hair loss. And it's very easy to confuse this with pattern hair loss because a lot of people do experience telogen effluvium, but probably not as many as people would want to think. Because people, whenever someone gets hair loss, they want to think it's telogen effluvium because telogen effluvium, they may know, is reversible. So basically,
it's going to grow back.
Telogen effluvium is stress-related hair loss, and once we clear out the stressor, then the hair usually grows back normally. Always goes back normally if it's truly telogen effluvium. So for example, like COVID hair loss is a temporary hair loss and it grows back normally. It takes time, of course, but it grows back normally. So that's the second type to be aware of, and it's hard to, it's easy to confuse it with androgenetic, so you really need a trichologist to distinguish between the two.
Okay.
Third one, most common that a lot of people experience is something called alopecia areata, and some people refer to this just as alopecia, which is very confusing because alopecia just means hair loss, and there's dozens of different types of alopecia. So when we talk about alopecia, and we're talking about this little patchy hair loss where you get little patches of hair loss on the scalp, it is reversible. So if you get this very distinct patch where the skin becomes smooth, all the hair falls out, it's usually treatable and it usually grows back 100%. That's called alopecia areata, where you get little areas of hair loss. This can expand into something much more, like cover much larger areas on the body. When it covers the whole head, we call it alopecia totalis. And some people will get it where it removes all the hair all over the body, and it's called universalis, alopecia universalis. Now, technically, they're all reversible, although when we get body and full scalp hair loss, it often isn't. There are some new medications, again, these new biologics that may be very helpful in the more extreme cases. But generally speaking, the patchy hair loss is quite easily treated and reversible. So now we've got three types that are specific types of hair loss.
Right.
The alopecia areata universalis totalis is a grouping based on the severity. Now the fourth type I want to mention is a group of hair loss conditions called scarring alopecias.
Right.
Now there are a lot of different types of scarring alopecias. There are a lot of alopecias that can have scarring. So I'll just talk briefly about these scarring alopecias. Now, scarring alopecias are autoimmune related alopecias or hair loss types that are not reversible. So where alopecia areata is also autoimmune related, it usually is reversible. Whereas scarring alopecia is usually not reversible, and that's because scarring means it scars the skin.
Right.
It destroys,
Kind of makes sense.
yeah. It destroys all the inner workings of the hair follicle and the hair shaft. So everything in the follicle is destroyed, including the stem cells. And the stem cells in the follicle are what's responsible for making it regrow. When the hair sheds, the hair regrows. These stem cells never disappear. Well, in
Right.
the case of scarring, they do disappear. And once that happens, the hair follicle can no longer rejuvenate. So a very important part is to understand is that a lot of scarring alopecias get misdiagnosed as androgenetic hair loss or even telogen effluvium. So again, this is where it's really important to see a trichologist and to get a microscopic analysis, because we know the clues at early stages.
Right.
And if you diagnose it early, we can often prevent the scarring from happening.
Wow.
So prevent the extent of it. So yeah, scarring alopecia is very important.
To get early diagnosis.
Early diagnosis is so important. So any type of unexpected hair shedding should be brought to a trichologist for a very detailed assessment.
Okay. And again, alopecia means hair loss.
That's right.
Okay, thank you. Next question. Why is it so important to properly identify the type of hair loss before starting a treatment?
Right. And so all the treatments for all these different types of hair loss we just talked about are completely different.
Right.
So for telogen effluvium, we don't even have to treat it. If we've got reasonable scalp health, the hair will come back on its own once the stressor is gone. We do need to identify the stressor and get rid of the stressor. So you can call that a treatment. There are some treatments we can bring in with telogen effluvium to help with regrowth. But technically, we don't need to treat it. We don't need to use minoxidil on telogen effluvium. We don't need to inject PRP on telogen effluvium. We can to help it, but we don't need to. In androgenetic hair loss, we do need to treat it. Okay, so, and the treatments are very specific, but the treatments for that are totally different than the treatments for alopecia areata. And again, for scarring alopecias, now there is some overlap with scarring alopecia and alopecia areata, and that is the anti-inflammatory treatments like steroid injections, steroid creams. But with scarring alopecias, we sometimes get into much more complex treatment protocols.
Okay, great. Thanks, John. What is telogen effluvium and why are we seeing so much of it lately? You kind of talked about that a little bit, about stress.
Yeah, so
seeing more of it.
Well, are we seeing more of it? We are. A lot of it's due to COVID, and even we're finding out COVID vaccines now.
Really?
Yeah, so I don't want to, say I'm against COVID vaccines or anything like that, but what we are noticing what studies are starting to show, and we sort of noticed this, that when we opened back up and started doing our analysis again in the years following COVID, is that we were seeing a lot more immune mitigated or immune mediated conditions like alopecia areata, telogen effluvium, scalp psoriasis, much more common.
All immune.
All three are autoimmune things, and we've had an increase since COVID. So there's a lot of studies going on that are starting to back this up. Yeah, so it's very interesting. Yeah.
Okay, great. Thanks, John. Alopecia areata can be really alarming. What causes it and how is it different from the other types?
Okay, so alopecia areata is an autoimmune type of hair loss. It's different from other types of autoimmune hair loss in that it's reversible, usually. So when we get little patches of hair loss, it's caused by the immune system attacking actually the pigmentation cells in the hair. So they're not really attacking the sebaceous glands. They're not attacking the stem cells. They're attacking more the melanin or color cells in the bottom of the hair follicle, right near where all the growth takes place. And what it does is it weakens the hair, to the point where it breaks easily. Once it gets above the surface, it'll just break off. And then it'll put the follicle into a state of dormancy. And this is where people make the mistake of, oh, the hair is dead now, the follicle's dead. It's not. It's just been put into a state of dormancy. For some reason. It's sleeping. It's like it's in a coma. It's not just, it's like it's in a coma.
Wow.
Due to this attack from the immune system on the melanin cells. So it'll sit in that coma until we can get rid of the inflammation, get rid of the immune system. So in alopecia areata, it's lymphocytes that are affecting the melanin. So if we can treat the scalp with, an anti-inflammatory to push away that immune-mediated response, then the hair usually grows back, because it's not permanently damaged.
Wow, that is very interesting. I never ever heard that before. That's really good. What are the biggest triggers for hair loss that people don't realize? Stress, hormones, diet?
The biggest triggers.
Is it stress? Is it hormones, or is it diet? What people are putting in their body? All of the above?
Let me see here. So if we're talking about those things specifically, we're talking usually about telogen, effluvium. So it's kind of a tough question. I would probably say the biggest hormone would be, the biggest trigger. Stress is very common. Hormone imbalances, while they can affect hair, they often don't. Even though we have them, they don't affect the hair. So probably with those, stress is the most common one. Diet can affect the hair, of course, can cause a telogen effluvium. It has to be a very severe thing. So like really rapid weight loss where you're reducing the amount of nutrients you're absorbing. And this often happens with the weight loss drugs. They're now finding that the weight loss drugs do have a side effect of hair loss.
Oh, God.
It's starting to show up in studies. Not to say you should stop taking them, but be aware of it. And, we have to start thinking about how we can mitigate this.
This is going to be in the future when we find out about these weight loss drugs. Wow. Okay. Can things like COVID, weight loss, or medication triggers suddenly cause hair shedding?
Yeah, absolutely. COVID, weight loss, medications, yes, they can suddenly trigger hair loss, and that's a stress-related hair loss. It's telogen effluvium. So the type of hair loss that occurs from these triggers is telogen effluvium. One corollary is that, some medications can trigger scarring alopecias. We talked a little bit about scarring alopecia already.
Right.
Some medications can trigger this. It's very rare, but it can happen. Some medications can trigger alopecia areata. Of course, we talked about how testosterone can trigger androgenetic alopecia if we have a sensitivity. So, yes, medications can trigger it. Usually, medications, weight loss. Usually, COVID. Usually, it's a telogen effluvium, a temporary, reversible type of hair loss.
Okay, that kind of brings us back to the question before, that the number one would be stress.
Yeah.
Right? Okay, so the next question is, what are the biggest myths about hair loss that you hear all the time? We kind of had an episode about myths, but let's bring it back again.
Yeah, so just as a reminder, myths that often occur, there's so many of them.
Shampooing.
Shampooing, the type of shampoo is causing the hair loss. The type of water is causing the hair loss.
Right.
The wearing hats is causing the hair loss. There's so many of these things that are really have no effect on hair loss whatsoever. It takes a lot to affect a hair follicle. A hair follicle has something that we call immune privilege. It means it's safe from the immune system. It shouldn't be affected by the immune system, so it doesn't get damaged. It doesn't scar over usually. If there's some, a scrape on the scalp, if we cut the scalp, it usually the follicles are very hardy, they can respond.
Right.
But in some cases, this immune privilege breaks down. We don't always understand why, but that can happen. So, myths, things like wearing hats and things like this are just not severe enough to have any effect on the hair follicles.
So that's the biggest one then, I guess.
Yeah.
The cat or the shampooing, I would think, right?
Hat, wearing hats,
all
the
of that.
shampoo, frequency and type of shampoo, these things. Yeah.
Okay, next question. How can someone tell at home what type of hair loss they might have based on symptoms and patterns?
Okay, so it's dangerous because
So number one, don't diagnose yourself.
Yeah, don't diagnose yourself because even
Don't do
professionals can misdiagnose, right? A lot of times we have to do a biopsy to really get to the bottom of it, and sometimes that doesn't even help us. So, don't try and diagnose.
Self-diagnose.
Don't try and self-diagnose. I mean, the safest self-diagnosis is male pattern baldness, where you're bald on top of the head, and at 60 you can say, yes, I have pattern hair loss. I have androgenetic alopecia.
Right.
But, if you're, especially women, because the pattern is much less obvious. It's not obvious, and you can't tell always what's going on the sides and back. So you really have to look at that. So don't try and diagnose. If you start to see excess shedding happening, if you start to feel tingling in your scalp or pain in the scalp, if it starts just to look thinner, then get it checked out. Don't try and diagnose it, because there could be something going on. And like I said, even some professionals misdiagnose things.
General
like
practitioners, even
scarring,
dermatologists.
scarring alopecias. I've had so many people come in with scarring alopecia that have been told they have androgenetic alopecia because they try and just look at it and think, oh, okay, yeah, it's thinnings, therefore it must be AGA, androgenetic. But in fact, there's a scarring going on, because early stages of scarring can just look like a little bit of thinning.
And diagnosing scar and alopecia right away or early is going to be the key.
It's crucial
for them.
It's crucial. So again, as soon as you see any signs of shedding, increased shedding or thinning, get it checked out.
Right. Go see your trichologist, Mr. John, Dr. John. Okay. Next question. Are all types of hair loss reversible, and are some permanent? So you talked about scar and alopecia being permanent, I think, right?
Right, yeah. So generally speaking, the scarring alopecias are the ones that are permanent. In very early stages, hair loss might occur and the follicle not dead yet, so we get some response to treatment of regrowth. But generally speaking, once the follicle is dead and killed off, it doesn't return. Androgenetic alopecia, once it gets to a super advanced stage, not reversible. And even alopecia totalis or universalis, if it's been there for years and years and treatments have been tried, and it just doesn't respond, technically it's reversible, but obviously it's not, because nothing's worked.
Wow.
Okay, so early diagnosis and treatment.
So if you're suspecting, make an appointment with your trichologist.
Yeah.
Okay, John, what does a proper diagnosis and treatment plan look like with a trichologist? So it kind of brings us back to...
Okay, so the way we approach it is, like I mentioned earlier, a patient should come in the clinic. We'll do a full case history, complete workup. If the person is underage, we want the parents to come in with them. So they...
What's underage? Under 18?
Under 18 is, we want... Okay. We want people that have access to all their medical history and know what they've, so that they know what their history involves and they can speak it to us. So a complete history of their medication, their health, their diet, any psychological issues in the past are important. And then we do a pull test, which is basically pulling hair from the scalp gently to determine how many hairs are in the shedding stage, or the resting stage, I should say, not the shedding stage, the resting stage, resting phase. We do a pull test, and then we'll also look at any hairs that are extracted. We'll look at the hair bulbs mainly to see and confirm that they are in fact telogen and that they are normal.
In a microscope?
Telogen. Yeah, under a microscope, yeah. And then, of course, we'll do a scalp analysis with a microscope as well, and this will just show us the state of the hairs coming out of the scalp. It'll show us follicles that may be dormant. It'll show us any scalp conditions that may be present. A few other things are there. There's a lot of signs we look for the different types of hair loss. Blood tests will usually be run, not always.
Right.
Often people have recent ones. Sometimes there's one or two missing that we need to run. But if, sometimes we just don't have any symptoms to worry about, and we don't always need them, but most of the time we'll run blood tests. And finally, for diagnostic, improvements, we might recommend, we might do a biopsy. So all these things come into the diagnosis. Once we do a treatment plan, it really depends on the type of hair loss it is. Some treatment plans are temporary. A lot of them are long-term, ongoing, depending on the type of hair loss. So, treatment plans really vary from different types of hair loss.
What about the microbiome?
Of the scalp, stomach,
the
and
test.
the scalp. So the microbiome of the gut.
This is new that we offer.
So the microbiome of the gut, if we have a person come in with, gut issues, some sort of irritable bowel syndrome, or celiac disease or anything like this, we may do a microbiome test, which basically tells us, how well balanced the microbiome of the gut is, and then if they need some specific types of probiotics to help regulate their gut microbiome, because there could be issues, affecting the hair growth. We want to make sure everything is covered. So if we do suspect that there's some kind of gut issue, then we can do a gut microbiome test as well. Yeah, that's important.
Okay, great. Last question. If someone watching is starting to notice hair loss right now, what's the first thing they should do? Well, you kind of answered that.
Yeah.
Call your trichologist.
Yeah, look us up.
Book an appointment.
Yeah, look up a trichologist.
In your area.
Do a little bit of research on them. Make sure that they're reputable. Make sure that they are certified and trained. There are people out there claiming to be trichologists who haven't taken any training whatsoever, and believe me,
Scary.
it's in depth, this training. It's so important, to be able to know what these scalp signs are, and there's a lot of very intricate signs on the scalp, and you need to be trained in order to properly diagnose and these. At Freedom Clinic, we have a team, as well as, it's not just me that diagnoses. I have a team that I can work with of nurses and nurse practitioners and even physicians that colleagues that we can even get advice from. So it's really important that to make sure that the person you're seeing is qualified and experienced specifically in hair loss.
Perfect. That's great, John. Thank you so much. Very interesting. So thanks, everybody. See you next time. Bye.
Bye-bye.